Hi, I'm Glenn Faison, Alumni Engagement Director here at Touro University, California, and I want to welcome you to the latest episode of The Current, our university's alumni podcast. Joining us today is Dr. Teek Yenpasuk. He's a graduate of the Master's in Medical Health Sciences program from 2018 and then transitioned into the Doctor of Osteopathic Medicine program and completed that in 2022. From there, you went on to serve a year as a resident physician with Alameda Health System in Oakland. And you are now entering, if I'm correct about this and did my math properly, your third year of residency as a dermatology physician at the University of Minnesota. Is that correct?
It's a final year PGY
Finally,
4,
okay.
so
All
fourth year
right.
of residency altogether.
Okay. And third year at
At
Minnesota, University of
Minnesota.
Minnesota in Minneapolis.
That's
Great.
correct.
Okay, great. So let's jump right in. Your educational journey since high school tracked heavily in the math and the sciences. A couple of associate degrees at Contra Costa College, your bachelor's degree at UC San Diego, and then both the master's program and the DO program here at Touro University, California. So I'm curious what drew you to the sciences and to math as you were growing up, because clearly you were tracking that way before you entered college.
Yes, no, that's a great question. For me, the sciences weren't just subjects in a book. They felt like the most powerful tools that I could find to help people around me. Growing up, I saw the real world impact of not having resources. I witnessed my family navigate immense financial and personal struggles. And I saw my friends dealing with, health consequences of drug use or lack or no access to healthcare or education. And so, I realized that I wanted to make a real difference, a real lasting difference, to go beyond just helping my family financially. I wanted a deeper understanding of the human body, health, and science and medicine were the clearest path to gaining that knowledge and skills to serve my community that I cared so much about and still care about.
That's great. So you worked for 6 years at Starbucks at one point before transitioning into a couple of roles that touch on the medical profession. Like there was one scribe role, if I remember correctly. What prompted you to focus on the medical field?
My time at Starbucks was absolutely essential to me. Initially, my focus was very immediate to help my family. Working full time right out of high school, during high school, and right out of high school was my stepping up of support for them. And so while I was there, my perspective broadened. I saw my friends and peers struggling with their health, partly because they had nowhere else to run. And then that experience ignited a bigger calling in me, and not only to just do more than provide financial stability, but I wanted to provide care. And that's when I made the decision to pursue higher education, um, like the sciences at my community college. Um, my journey into medicine and specifically dermatology is deeply personal. It started with a single maddening symptom, a constant severe itch all over my body with no rash, and initially dismissed by many doctors. I was on, public insurance. I was seeing different doctors each time I went in, told that I was, quote, young and healthy, and that this was just probably eczema, given creams over and over again, but things never improving. Um, Even though I knew something was wrong, I didn't have that health literacy yet to really advocate for myself. And when I had this, final turning point is when I was able to finally see a skin doctor, a dermatologist, and this doctor, sat me down, really listened to me, took my story seriously, didn't just rush me out of the room like I just had eczema and I wasn't using my creams or lotions. She did a thorough workup, and that's when she, found out that I was diagnosed with stage 3 Hodgkin's lymphoma. And so this itch was a symptom of cancer, was perineoplastic itch, and that diagnosis was grueling. It followed with chemotherapy, it followed with radiation therapy, and it changed everything. Um, it was more than just my fight to survive, but it was, the experience of being misdiagnosed, feeling of being unseen, that ignited my passion to, complete community college, transfer to University of California, San Diego, and then become a pre-med, and set me on the track of like continuing to advocate for my patients, especially from underserved communities, especially with those of skin of color, especially of those who are often overlooked.
So your cancer diagnosis and treatment would have happened in your late teens, early 20s then?
Early 20s, yeah, I was a young
Early
adult.
20s? Yeah, that's, wow, that had to be frightening. Any lingering effects? Cancer free?
Cancer free, thankfully. I'm in a well, they now have a pathway for cancer survivors to have certain tests, every so often, every couple of years, just to make sure things are going well. Some of the chemotherapies that I had and the radiation therapy that I was exposed to have a potential of causing a secondary cancer in the future. Radiation therapy as well has the potential of causing certain skin cancers in the future as well. And so I am constantly monitoring myself, but the cancer that I was originally diagnosed with has been cured.
That's wonderful. So you've entered your fourth year of residency, as you described earlier. So what's that journey been like for you? So you finish it, you finish here at Turo, you're 3 years basically on campus and the 2 years on rotations, and now you're off on residency. What's that been like? Kind of share your experience with that with our audience.
Yeah, residency has been an incredible period of growth. From an intern year at a county hospital at in my hometown to seeing, the community that I grew up with and serve as a physician has been super impactful. Some of the biggest surprises for me was realizing the gap between knowing about health disparities and being able to do something about them within the system. For example, I work with many patients with a disease called hidradenitis suppurativa, HS. It's a very debilitating skin disease, and we have effective, laser treatments for them. But often these laser treatments aren't covered by insurance at the county hospital level, for example. And so the biggest lesson has been that being a doctor isn't just about what happens in the exam room; it's about advocacy. It's prompted me to lead quality improvement projects to fight for insurance coverage for these lasers, and that's the unexpected part of the job, like becoming a system changer to ensure your patients get the care that they deserve.
So you basically, but it sounds like you basically serve as well as a public health advocate for your patients. Is that correct?
Definitely, that's correct.
Okay, well, that's wonderful. So, what advice do you have for current DO students? First, for the ones that are in their didactic still, and then after that, for the folks that are in their rotations.
Yeah, that's a good thing to ask because my biggest advice to my mentees and to those who are in the DO field and want to become physicians is never lose sight of the why. Medical school is a marathon. It was not easy. I'm not going to sugarcoat that it was a walk in the park. There will be days where you feel overwhelmed, but like you have to remember that your own personal mission of why you started this journey, that's the fuel that will get you through the rough days. And for me, it was my experience as a patient and what I wanted to do on the other side. Um, Secondly, don't wait until you graduate to become a leader. I helped found a free health clinic. I worked with our Toro's free health clinic. I was president and co-president, a leader of many organizations on campus. I worked with our medical school's curriculum. And so you have to have your voice and perspective that's valuable right now. Don't You do not have to be a physician to have that voice, to have that value. If you see a gap or a need in the system at school or in a club, propose a change, organize an event. Your training is the perfect time to make an impact.
So that's great. It sounds like a lot of that happened during your didactic time here. What advice do you have for folks that are already on their rotations, those 2 years of rotations?
Yeah, it's also again a marathon. Rotations, you have to now be in clinics or the hospital, and then you still have to study after you get home from a long day. So it's even harder, right? And so you take those days day by day, you learn something that you saw. If you saw something interesting in clinic, go home and read about it. Don't try to study everything all in one day. You're going to burn yourself out. Take it day by day. Take it step by step. Ask questions. Come informed. Be thoughtful. Be kind to the nurses, the ancillary staff around you, and that's going to bring you really far.
So I know here at Turo, there are a lot of opportunities for interdisciplinary activities and collaborations. You mentioned the student-run free clinic. There are other things. How important is that to have that solid foundation in an interdisciplinary setting?
I think it's vital. I remember collaborating with the PA program, collaborating with the pharmacy program, with the Masters of Nursing program. These are gonna be your peers in the future. Interdisciplinary work is so important, and in order for you to become a successful team player, team leader, you do have to be able to interact with people from different scopes of practices.
Okay. I'm going to transition a little bit. You're quite active on social media,
Yeah.
which is wonderful. We love watching your stuff here on campus, here in the Office of Advancement. How does that fit into your philosophy as it relates to the practice of medicine?
Yeah, for me, social media is a powerful tool for patient empowerment. My own journey started with being misdiagnosed because I didn't have the language or knowledge to advocate for myself effectively. My goal online is to bridge that gap. I want to provide accessible, evidence-based information that, demystifies dermatology specifically, because that's my field, especially for skin of color, skin of sexual and gender diverse populations. It's about giving the people the tools to understand their bodies, their skin, having more informed conversations with their doctors. What I hope to get is the confidence to be an active partner in their healthcare. Um, the pandemic, for example, was like a magnifying glass on the issue that was already present in our healthcare system. It made the existing health disparities, impossible to ignore, and so
Yeah.
it really showed that, like, there are disparities in communities of color, lower income populations. They are disproportionately affected by health crises, and so social media to me is a way to break those barriers, to help bring health education, health literacy to the community, as well as other, healthcare professionals, primary care, pediatrics, psychiatry, things that, sometimes skin is really hard for primary care specialties or other specialties, and it's a dermatologist specialty for a reason. And so this is also a platform for other physicians and other healthcare providers to learn.
Okay. So you mentioned the pandemic. You completed your medical school and into residency while all of that was happening. And I'm not sure if we're out of the pandemic. Can we call this the immediate aftermath of the pandemic in 2025? Or, how do we describe the pandemic now? Or do medical professionals really know yet?
you know, I think it hit us hard. It caused a lot of burnout, caused a lot of fear, caused a lot of scare, but it also built resilience, and it made us more, savvy, it made us more intelligent, it made us more cautious. Um, I think we're getting out of the pandemic. We're out of that pandemic, but it will leave lasting effects on those who've trained through it and those who've worked through it. But overall, I think it's built, a stronger community with the healthcare system, and it's highlighted different, disparities, and it also has fueled, many doctors and future doctors to really reinforce the urgency of being more equitable in healthcare, building trust in underserved communities, tackling systemic barriers, using technology to make accurate health information. AI, for example, it really boosted that. And so there are pros and cons to everything, but we have to keep looking forward.
So we hear that it's, you know, because it's a coronavirus at its core, that it's likely going to be around forever, and maybe we'll be getting annual shots like flu shots and things like that. What have we learned? What is the medical profession, what's the takeaway the medical profession has learned about how to be ready in case something like this happens again?
Yeah, I want to preface that I'm not an infectious disease doctor, and not everyone, works the same way in different fields, treat different diseases in their own way. But I feel like we will be more prepared if hopefully never, but another thing like this happens. Just like the flu virus, just like the common cold, viruses can mutate, and vaccines help prevent, further sickness. And I'm a huge advocate for vaccinations. I have patients on multiple biologic medications, and before I start them on these medications that immunosuppress them, I ask them to get vaccinated first. And so there are benefits to these vaccines, and with COVID, it's likely possible that it will be like the flu where, it will mutate, it will change, and we will need to get an annual vaccine for it. Um, and so that's just going to be a part of, our lives moving forward.
So we heard a lot on the news and anecdotally through folks that have come through the programs here about how healthcare professionals essentially got burned out during the pandemic because the need was so great and so intense for such an extended period of time. How do you how do you cope with that? How do you decompress? I mean, even kind of on this trailing edge of the pandemic, you're a doctor, you're treating patients all day, every day. That's a stressful situation just by itself. So how do you manage that, and what kind of advice do you have for folks that so that they don't burn themselves out?
Yes, it's important to be human outside of your white coat. And with such an intense career like becoming a physician, decompressing should be non-negotiable. It's about balance. I'm a big believer in the mind-body connection that's central to the osteopathic medicine mantra. And so I make time for physical activity, whether it's hiking or just getting a good workout in. I make time to connect with my community, my loved ones. Um, honestly, just being a part of reconnecting with why in a low pressure way. Why am I doing this today? Why do I feel like this? Checking in with myself. Um, if that means spending time with my family and friends who supported me through all of this, or if that means creating educational videos for social media while still at work, it is how, everyone's own journey and own way of decompressing is different, but it should be something that you integrate into your daily lifestyle, especially as a physician.
Is there an opportunity to employ some of those skills during medical school?
Oh, absolutely. Absolutely. I went to mindfulness days. I went to wellness days that we had. I went to yoga days. I was a part of the HIIT HIT club to work out. I did a lot of those, and it is definitely possible to do. It seems like you need to study and do things all the time, but if you take breaks, I promise you, again, it's a marathon. You will get to where you need to be. You'll be able to, not burn out, and you will feel better.
So I want to jump back into your time here at Turo. What was one of the most difficult challenges that you faced during medical school that you had to overcome, and how did you overcome it?
I think, you know, studying is always going to be difficult. Probably number one to many other people, unless you have some crazy photographic memory or you've done this before. I think finding my learning how to learn, learning how to learn was difficult for me. I had to do the master's program to really learn about how my study habits were. I didn't get into medical school right away after college, and the amount of information that we have to learn in medical school is tremendous. And so I think, navigating that was difficult, but I do believe the master's program did help me with that. And there were other, tidbits along the way. I lost my grandparents in medical school months, months after each other. I lost an uncle. We, a lot of losses, a lot of sacrifices, a lot of pains, a lot of missed weddings, missed birthdays. Those things, unfortunately, are part of medicine, and so having the outlet to cope with that, it was paramount to my success.
So I want to try to like turn it around and lift you up a little bit here. So why don't you share one or two of your most fond memories of your time here at Turo?
Yeah,
Think
I had amazing mentors. Dr. Pena was one of them. Dr. Hendricks. There were lots of people who supported me and were rooting for me. I had amazing friends, Bonnie, Paul, Jorvik, all these doctors and people who, I would study with, work with, go get food with. I made an amazing, community that I built there that we advocated for the local community of Vallejo. Those are some amazing moments working with underrepresented minority high school students who in empowering and inspiring and motivating their minds to go into healthcare and sciences whether they were an immigrant themselves or child of an immigrant. That was really impactful um, to me. And I now, years later, since it's been a while since I've been in medical school, 4 years now, I see them graduating college. I see them trying to apply for medical school, things like that. And so, you really make a difference in the minds of the youth and people around you.
So I know you like to keep in touch with folks. How can people get in touch with you if they want to connect with you about the stuff that you're doing on social media or about anything else?
Yeah, if medical students are interested in health equity, dermatology, skin of color, skincare, evidence-based medicine, they can reach me on all social medias at Derm Dr. Teeks, Teekz, at Derm Dr. Teeks, and I'd be happy to answer any questions that come my way.
Well, that's great. I'm sure they'll be thrilled to hear from you.
Thank you.
Well, I think we're about at our time limit here. It's gone by fast. I want to thank you for taking the time to join us from Minneapolis. I hope we didn't take you out of your workday. And I want to thank our listeners for joining us. So until next time, everyone, take care.
Thank you. Thank you. And if you all want to know more about skincare and healthcare, at Derm Dr. Teeks.